to join us. And so we promised them that we would record this and that we would send them the session via our monthly e-blast that you get, our newsletter, ITQI newsletter. We have some more people joining, so I'm going to just let them come in. Hi there. Thank you for joining us. If you can, please put what program you're from and what part of the state you're in. Where's everybody from, Laura? Can you see? My screen's split. Looks like we have all over. Okay. And did Sasha come in, guys? Do you see Sasha? I'll need your help with that, Riva.
Okay. I do not see Sasha yet.
Okay. Yeah, I will shoot her a quick message and then we'll get started. Okay, we're gonna get started. So I'll just do some introductions. I'm Maria Montoya, and I am the senior strategist with the ITQI team. We are kicking off this month our TA session. So you all have given us a lot of insights and info about what kind of support you need. You've been very clear about what you don't want, and we just love it because now we have a very good idea of how we can spend our TA resources and develop some things that will first be distributed and go out to you all. So that's our ITQI providers, as well as the awesome folks who most of you are more familiar with at the resource centers, our superheroes at the resource centers. And they will then get distributed once the ITQI grant wraps up and we do our report and recommendations. We will put them on the larger website in more broad use across the state to the rest of the providers. But you guys could kind of get the first opportunity to check things out. This session, I will tell you, is led by me and our awesome Sasha Klein, who does our advocacy policy work. Don't know if I said that wrong. Y'all have to bear with me today. I had a root canal yesterday, but we did not want to cancel on you. So this is going to be mostly ECI, Great Start to Quality team you are working with today, but we're going to bring you experts each month. And so when we do the wage session, we have some folks who are going to jump on and tell you how they've handled wages next week. And then next month, we're going to also have some folks who do marketing, paid marketing and media, and they're going to give you some advice on like what not to pay for, and some of these platforms that are being sold also give you some insights into what you should or should not be maybe investing in. A lot of you have had questions about that. And when I speak about recruiting, want to be clear, the ITQI grant is both about recruiting the children always, but also helping you with the recruiting and the retaining of the employees, right? So that's number one. And so some of the strategies that we'll talk about will be for employees, and then some of them will be for the families. I'm going to ask one of the ITQI team members, one thing I didn't think of is you guys could keep letting people in, Riva. And then I'm going to put the PowerPoint up, Sasha, and let you go. And time-wise, I think talk as much as you need to share. And then as people have questions, I'm going to share the toolkit that we have about the new subsidy policy changes, and then also take folks' questions about some strategies on how to use that. So we will also talk about that in our section next month. So if we need more time, we can hop over into that session that we're going to have next month.
Oops. Am I unmuted now?
Yep.
Great. Well,
Yep.
hello, everyone. Thank you for allowing me time on your agenda to talk to you a little bit about the opportunities for advocacy and connecting with your lawmakers about the infant toddler quality improvement pilot and about infant toddler contracts in general. We wanted to provide an update for you about kind of where things are at, the current context with respect to the possibility of funding in our next fiscal year, and then to let you know ways in which you can be part of influencing that decision that's being made by our lawmakers. And then also to share some information that we've been able to pull together thanks to the amazing job you all have done around sharing program data in real time with us. The response rate for that has been fantastic. And what it has allowed us to do is very quickly pull together some evidence around the impact of the quality improvement pilot that ECIC and all of you can be using to talk to lawmakers about the value of this investment. So let me go ahead and get into my slides into full view here. I'm going to run through some things. I've got a handful of slides. If you have a clarification question, please, I guess, share it in the chat, and hopefully Maria or somebody on her team can let me know. Otherwise, I will definitely leave time for questions at the end and for comments. So my agenda, here's what I hope to cover. So I mentioned the context, a little bit about how the state budget process works, where we are in that process, and then also how this new federal rule that that has been passed around the Childcare and Development Fund affects contracts, including infant toddler contracts, and then talk about how you can influence the budget process. And then share with you some of the data that we've been able to pull together about the pilot that if you speak with your lawmakers, you may choose to share. So in terms of context, as all of you are probably well aware, the infant toddler quality improvement pilot was a one-year pilot. It was funded with one-time federal ARPA dollars. So that's funding that the federal government made available to Michigan to help stabilize childcare during the pandemic. And we are using up the last of those funds right now. So there isn't currently a dedicated funding source to continue the pilot or to implement infant toddler contracts going forward. So part of what ECIC and our advocacy partners have been doing is speaking with lawmakers about what kind of opportunities might exist in the fiscal year 25 state budget. So this, I guess the main thing I want to share with all of you, if you take home one message from this is what I would hope you would walk away with. Right now is when your legislators are making decisions about what will and will not be funded in the fiscal year 25 budget. We are right in the middle of sort of the budget process, and this is a critical time for you. If you want to let legislators know about your experience as a provider and a participant, a grantee in the infant toddler quality improvement pilot, this is the ideal time to be reaching out to your lawmakers and letting them know what your experience with the pilot has been like, what infant toddler contracts have meant for you as a childcare business owner or operator, and also what they have meant to the families that you serve. Another important piece of context, in addition to the fact that we're sort of in the middle of this budget season, is some of you may be aware that the federal government has passed this new rule that requires states to use some infant toddler contracts as part of the distribution of childcare subsidy dollars. So effective April 30th, so effective very soon, the feds have an expectation that states, including Michigan, will have some contracting system, and they literally use the word some. So we don't know kind of at what level. They're expecting this to be true. We know that they have given states the option of applying for a waiver to temporarily delay implementation of this new rule. The maximum amount of time a state can delay it for is 2 years. So we know that Michigan may or may not apply for a waiver of that kind. So in other words, they may say we're not in a position to do infant toddler contracts moving forward quite yet, but here's our plan for getting there. Or they could not ask for a waiver and they could move forward with a plan to have infant toddler contracts. And I should specify what the federal rule actually says is that the states would use contracts for some kind of high needs, basically groups to serve high needs groups. So infants and toddlers are one of them, but they also specify children with special needs and disabilities. And they specify providing care in what some folks have referred to as childcare deserts, but basically geographically underserved parts of the state. So where are we in the fiscal year 25 budget process? What this image shows you is kind of a month-by-month timeline of how the budget process works. In a nutshell, in February, usually, our governor will come out with what's called the executive budget, which is a proposal. It's her office's suggestion for what the budget should look like in the upcoming fiscal year. And that sort of starts a conversation and a series of debates with the legislature about what the final budget that gets approved is actually going to look like. But it's always good if the governor includes something in her proposed budget to fund the things that we care about. So some good news, the governor's budget for this year, which was released on February 7th, included a 10%, proposed 10% rate increase for the childcare scholarship program. So what we are more familiar with calling childcare subsidies. That still doesn't get us back to where we were last year before the 26% rate cut that happened when ARPA funding ran out. But at least she did include a rate increase. She also included a 30% rate increase for folks serving children in the foster care system. The other thing that was positive in the budget was that she is proposing $60 million to do what we call the Kentucky model, but basically it's many other states besides Kentucky at this point are doing this, where they have essentially made early educators categorically eligible for childcare scholarships for their own children, regardless of their income. So right now we know a number of childcare providers, their wages are so low that they actually qualify based on income limits to have their own children receive childcare scholarships through the state. But many childcare providers or early educators' incomes are just high enough that they don't qualify for that assistance. This would make you and your families categorically eligible. So that's something that we at ECIC and also the Think Babies Michigan Coalition that we help facilitate has been advocating for some time. The governor did include that in her proposed budget. What was not in her proposed budget was additional funding for the infant toddler quality improvement program. So that is not ideal, but this is a process. So the budget process is a series of negotiations, and there are several points along the way to influence the final outcome. So after the governor basically submits her proposed budget, the next thing that happens is that the appropriations subcommittees in both houses of the state legislature start to meet, and they come up with their proposed budgets. And those committees are divided up into kind of different categories and subject areas. The MyLeap budget because MyLeap is a new department, has been placed within what used to be the Labor and Economic Development Appropriations Committee. It now includes, they're now called the Labor, Economic Development, and Lifelong Learning Committees. And they are in the process this week and next week of releasing their proposed budgets. We don't know for sure what those are going to look like at this point. We will know shortly. But what we're hearing so far is that the House version may hopefully include a placeholder for infant toddler contracts, although no funding. And I'll explain what the implications of that is in a second. We're not as clear about what's going to happen on the Senate side. So we're waiting to see. The other thing that's happening, though, on the Senate side, which is exciting, is that Senator Kristen McDonald-Rivet, who's been a longtime champion for early care and education, she was herself before becoming a legislator, a child care business owner. She has just last week released a bill package around comprehensive funding for early care and education in the state of Michigan. And those bills address a number of things, including, for instance, one of them would create a cost of living adjustment to childcare subsidy rates if it were passed. That would go into effect each year. There's a number of things in there that are really exciting. She has two other pieces to her proposal that aren't reflected in the bills, but are reflected in the work she's doing in conversations with MyLeap and in her work with other legislators. She is pushing, as are we, for a restoration of the 26% cut to the childcare subsidy rate that you all experienced last year. So rather than the governor's 10%, she's asking for reinstatement of the full 26% that folks lost. She is also proposing $100 million for infant toddler contracts. No one is clear on where that $100 million is going to come from or where it would come from, but that is what she is pushing for. So that's sort of where we are in this moment. And then you have this extra complicated piece about the federal rule where when MyLeap sort of went to the governor and said, hey, this is what we think we need in our budget for next year, they didn't know that that federal rule was coming. So they didn't know that they would have to include some infant toddler care potentially. Now they know that that is the case, but the budget process has already sort of kicked off without that. So there are also some opportunities internally with MyLeap to be advocating with them about how they are going to come into compliance with that federal rule and what a budget would look like that would support that. So here's the next step, and this is where all of you have a really ripe opportunity to influence the way things go forward. I mentioned that we're hoping to see a placeholder in the Senate budget for infant toddler contracts. That's not a guarantee, but that's what we're hearing from the Chair of Appropriations. You might ask, why do we care if there's no money attached to it? Here's why we care. The next step is after all of the House and Senate appropriations subcommittees release their budget, then the two houses have to get together and kind of duke it out to see if they need to reach agreement on what their budget proposal is going to be across both houses. And they do that through something called conference committee. And conference committee provides another opportunity for advocates to ask for specific changes to the budgets as they currently exist. And it's really important at that point that the head of both the House and the Senate Appropriations Committee and the chair, so the chair of that committee, and then the chair of the subcommittees that are responsible for the MyLeap budget are hearing from constituents about what they want to see happen with infant toddler contracts, because that's the moment when they could potentially change things and add things in, including funding that isn't currently in the existing version of the budgets. And then, of course, after conference committee, there's a final vote, the budget goes forward, it goes to the governor, and the governor has the opportunity to essentially sign it into law or veto all or part of it. So how can you influence infant toddler contracts and funding for them in the fiscal year 2025 budget? The most powerful thing that you can do is share your personal story with your legislators about how the ITQI pilot has impacted your business and how it has impacted the babies and the families that you work with. Policymakers, if you haven't had the opportunity to meet with your state representative or your state senator before, I know for some people that can be sort of an intimidating process, but the reality is that these folks work for you. They represent you. You are their constituents. You are the reason that they are in office, and they want to hear from you. In fact, when we do advocacy work and we try to get meetings with legislators, we know if we're getting trouble getting a meeting anytime soon, that the fastest way to get in the door is to reach out to somebody who is a constituent in that legislator's district, meaning they either live there and or they have a business there. Because if you're a constituent, they want to hear what you have to say, right? Especially if they want to stay in office. So they want to hear from you. They want to know what is and isn't working. And when you can tell a story that clearly supports a specific request or what we call an ask from the legislator, that is probably the most powerful thing you can do. So what I mean by a story is, how have the infant toddler contracts personally affected your business? And like I said, how have they affected the families that you serve? Even sharing stories about specific families, sharing stories about if you've been able to hire new staff because of these contracts, letting them know what that's, how many new staff you've been able to hire, what that's meant in terms of business operations, how many more babies you've been able to serve as a result of this, what the impact of that has been on their parents' ability to join the workforce. We know that the Michigan Chamber of Commerce came out with a study last year that basically showed, and this is the Chamber of Commerce, this is the business sector, right? Shows that the Michigan economy is losing almost $2.9 billion every year because of an underfunded childcare system, right? But those numbers don't mean anything until legislators can put a face to it. So please, if you want to, share your story with your legislators. There's lots of different ways to do that. If you're not sure who your legislator is, and you might have two different ones, right? You might have one who is your representative given where you live, and then you might have a different one given where your business is. But you can go to this website here and you just plug in your business address, or you plug in your personal address, and it will tell you who your representative in the state house is, and it will also tell you who your state senator is. And you can then reach out to them. You can call them and let them know how you feel about infant toddler contracts and what you're hoping to see in the fiscal year 25 budget. You can write them an email. You can write them a letter. I am always a big fan of, if possible, getting face-to-face contact, although the budget moves so quickly that you may want to call or write in the meantime, but go ahead and ask for a meeting. Don't wait for the meeting to let them know kind of what you're thinking, but you can ask for both. And then in terms of building long-term relationships and really helping them understand the industry and the value of the work that you all do, I always encourage people, invite them to come visit your program. We just met with Senator Bayer yesterday, and she was complaining about how she had been invited by a constituent to come visit a landfill. And she's like, I hate landfills. I don't want to go visit landfills. She's like, but I'll visit a childcare center, And there's a lot of people out there, a lot of our legislators are of a certain generation, and they're men. They may not have been the one who was actively doing the child rearing in their own families, and they may frankly just not get it in a lot of ways. And there can be something about inviting them to come and see in person what it is you do, and talking to them as a constituent, as a person, that can be really powerful. So you can do any and all of those things. But given where we are in the budget cycle, I would encourage you that if this is something you're passionate about and that means something to you, at a minimum this week, to consider calling and or writing your legislator. So what can you share with them? So as I already said, the number one thing to share are stories, right? Stories. So if it depends on what you want to ask from them, but if you want to ask them to fund another year of the infant toddler quality improvement pilot, or you want them to come up with funding for infant toddler contracts, you're going to need to explain what that is, what the program is, what it means to have an infant toddler contract. And then you want to share your story about why you consider that a valuable investment. The other thing you can do is share information from 2 different briefs that ECIC has created, thanks to that data that you've provided. So the first brief is 100% done, and I can work with Maria to make sure that copies of this brief are shared with you all. What we did on this brief is we looked at the data from all of the 1,700 infant toddler childcare providers who applied to be part of the infant toddler quality improvement pilot. And we used that data to demonstrate that we've got a problem in this state. We've got a problem, and we have a problem that needs a solution. And the problem is that we have an infant toddler childcare supply crisis. So we have roughly 6,400 licensed childcare providers, licensed to serve infants and toddlers. More than a third of them applied to be part of the pilot. And based on those 1,700 programs, so just 1/3 of what's out there across the state, they reported that in that moment when they were applying, that they had a total of almost 9,000 infants and over 10,000 toddlers on their wait lists, right? So that tells us that if you just kind of did some back of the napkin math, what that suggests is across the state, childcare may be unavailable for well over 72,000 infants and toddlers. We just simply don't have enough supply out there. And you all know better than anyone the reasons that that is the case. We also know from that application data that part of probably the biggest thing that drives this supply crisis is that we are not able to pay our early educators, our baby brain builders, what they're worth. This is skilled labor. It's not just something people do as a hobby, right? It's a job. It's part of skilled labor. And right now, we know from that pilot data that providers, the average wage that we're providing, we're able to pay our infant toddler teachers is less in the state of Michigan than the average wage of a fast food worker, and significantly less than the average wage of a major retail employee. And then we also know that the applicants reported significant staff shortages, right? So when you're not able to pay people a living wage, and folks can go elsewhere and find a job that will pay them that and will provide benefits, then it gets to be really challenging, right? To hold on to your staff and to recruit new staff, especially qualified staff. And so this slide shows you, just for those 1,700 applicants, just how many staff openings they had for infant and toddler educators. One thing as you talk to your legislators that it's important to share, this is obvious to all of you, but it is not necessarily obvious to them, is the reason why we can't afford to pay infant toddler teachers all that they're worth. They need to understand that how expensive infant toddler care is, why it's expensive, and that the reality of how much parents are already paying, and that we simply can't be asking parents to be paying for more. And the reality that the Child Care Scholarship Program does not come anywhere close to reimbursing you all for the actual cost of providing the service to infants and toddlers that you provide, right? That the reality is every time you do that without a contract, to help sort of equalize the funding, you're losing money. So without those contracts, that is not a sustainable business model. So then we have another brief that will be available next week. And again, I can share that with Maria and her team to pass along to all of you. This brief basically looks at those first 4 months of data that you've provided and offers early evidence of the positive impact of the pilot on the outcomes that it was designed to achieve. So we have 195 providers who've been funded. People often want to know who are those providers, right? It's just a small subset of the providers that are out there. 95% of you all are childcare businesses funded, operated and directed by women. Almost half of you by BIPOC women, so Black, Indigenous, or other people of color. So these are, I think it's really important for lawmakers to understand and think about you as a business, a micro or a small business. Even fiscal conservatives, they want to support businesses, right? And so I think that's an important point to get across. 70% of you are caring for at least one child with a developmental delay or disability that qualifies them for early on. 80% of you are offering non-traditional hour care. And 91% of you are located in states that are within what the state refers to as childcare deserts, so geographically underserved areas. This is a map of how the funding got distributed across counties. So we took all of you who are part of the pilot, the funding that each of you got, and we added that up within each county. Those are the total dollar amounts. This map is your friend if your county has a dollar amount in it. And maps are, I had a friend who used to refer to them as data treats. As an advocate, legislators love pictures. And they love pictures if it tells them that something is providing funding for their district, right? So if you are meeting with local legislators, I encourage you to share the brief and or share a copy of this map so that they can see this program is providing this amount of money to our community, to your district. And if we can't find a way to continue to fund it, that money's going to go away, right? So if that's the message you want to convey, the map can be really helpful. And then lastly, here's what we've learned from just the first 4 months of the pilot, right? You guys are just getting your feet off the ground. Already, we have seen an average increase of $1.44 increase in wages for infant toddler providers amongst those of you in the pilot. So that's looking at what you were paying your staff before the pilot started in November to what you were paying your staff when you reported your data from March. That's what we want to see. That's what providers want to see, right? That this is money that isn't being pocketed. This is money that's going back out to the workforce. Not surprisingly, as a result, we've also seen promising outcomes already with respect to staffing. So pilot participants have already hired 76 new full-time infant toddler teachers during those first 4 months, plus a small number of part-time infant toddler teachers. And then lastly, and this is probably the most important piece, this has resulted and cascaded into already an increase in supply of infant toddler care. How do we know that? We know that you all have reported that between November and March, you have been able to take 491 babies, infants, and 672 toddlers off of your wait lists, right? Presumably in most cases because you are now able to serve them. So indeed, the pilot is doing what it was designed to do, which is to help make sure that more babies and toddlers are getting high quality, safe care in their communities. So with that, I want to pause and take questions. But before I do that, I just want to say, as a single mom with 2 no longer babies, but I remember very clearly when they were, just how much I personally appreciate the amazing work that you all do. I believe wholeheartedly that all of you deserve to be being paid so much more than you are. And that is something that I and my team fight very hard for. And we know, though, that the best way to win that battle is for lawmakers to hear directly from you. So if there is ever anything that we can do to support you in reaching out to your lawmakers and advocating for yourselves, we are here to do that. We love doing that. And I'm sure Maria can share my direct contact information as well. But thank you, I guess is really what I want to say at the end of the day. We so appreciate you. That's it. I'll take questions or comments.
Thank you so much, Sasha. Does anybody have any questions they want to ask? I see you all chatting in the chat box. Feel free. Let us know if you can't come off mute. I know I tried to make it so you could come off mute. Awesome. There were several questions about where these assets will be. So Sasha and I are going to get together and make sure that the recording and the materials she spoke about go immediately onto the website as soon as we can get them posted. But then you will also have them brought back up, lifted back up in your ITQI monthly newsletter. And I see Lachelle has her hand raised. You got a question?
Good afternoon. Thank you. My name is Lachelle Warner. I'm from Wonder Year Child Development Center. Early on, you spoke about the federal government's new requirement to have contracting systems. What exactly does that mean for child care providers?
So that's a great question. So the way that the subsidy system works now in Michigan, we have what the feds call a voucher system, right? So you provide care to a baby. If they qualify for a child care scholarship, you then get reimbursed from the what we used to call the CDC program, right? From the state for care at the current rates, reimbursement rates that they have. One of the things that folks have realized is that if instead of basically reimbursing you for actual services provided, if instead they contract with a childcare provider for a slot or a space, rather than for serving a specific child, but for having a slot or a space, that really helps stabilize providers because you can then count on that money. You're not subject to the whims or kind of the instability or circumstances that happen with families who may be here one day and gone the next, or may qualify for subsidy one day but no longer qualify the next. It's a more stable, reliable source of funding for the provider. Additionally, contracts, as is the case with the infant toddler quality pilot, often can augment or increase the total amount of funding that a childcare provider receives from the government, because they are often, not always, but often designed to get closer to the true cost of providing that service, as opposed to sort of the particular subsidy reimbursement rate that the legislators, many who know nothing about childcare, have set. So that's what we mean by contract. So it's a contract for a space rather than reimbursement for a particular child.
Okay. And just to follow it, just so I'm clear. So example, if the contract will be based on the number of infants or toddlers in your particular program, and you're paid for that number of children. Is
So
that
you're paid, you would be paid for the number of slots or seats that you hold for subsidy eligible children.
Got it. Okay. Thank you so much for clearing that up. Thank you.
Yeah, you bet.
Basically, this grant program, the way that we've structured this, has been contracts. So you have gotten paid, for the X number of slots that we agreed with you, to fund for you at the beginning of the program. You've gotten paid regardless of your billing each month, right? So it's that formula, if you will.
Tam, do you want to go? Can you talk?
Okay.
So that's what my question was, that when we're speaking with legislation, can we comment how that's kind of rolled into what this grant is doing for us? Is that the only difference would be is that for like myself, I have 3 infants that are special needs. I'm only being counted, like there's one payment for that one, because we only had to supply documentation for one. The difference would be that we would have, if we supply documentation per se for like 7, then those funds could be increased if we had 7 children that fit that criteria. Something
If
like
you-
that, like part of my impact when I'm talking to them. I don't want to overstep and say, oh, well, this grant does this, this, and this, and it's the same thing, and think that we have funding.
So it would, oh. You know what the echo is coming from?
I think we had one of those note takers. Let me, I'll try to find it.
We'll pause for a second.
Yes.
Try again. There,
Yeah.
that's better. Thank you. Yeah, so you would have a period of time, as I understand it, like you did with the infant toddler quality improvement pilot, where you've negotiated, this is the total number of slots, right? Based on kind of the number of subsidy eligible babies that you've been working with. So we anticipate you'll be able to serve X number of subsidy eligible babies. And so we're going to contract it with you for that number of slots.
Right, but my point was more the fact of is that what this is doing for us, when I'm explaining it to legislation with the new funding that's in the bill for the fiscal year 25-27, where it's asking for contracts for special needs and children with infants and toddlers. What we're doing right now, the difference between the two is right now we are only paid an additional fee for one infant toddler with special
No,
needs.
so
Laura?
the way that we structured this formula is if you're caring for any, there was a bonus that was paid across the board per slot. So
Okay.
each
I just
slot,
want to make sure I
was
say it
ba- yeah,
right.
each slot was based on on the formula. So your base rate was based on your current quality level. Then there was a bonus if you had any children with special needs, I should say infants or toddlers with special needs.
Mhm.
Then there was a bonus if you had, XYZ, right? So,
Right.
and then we gave you a per slot amount based on all of those criteria. And if we funded you for 4 slots, it was 4 times that amount, right?
I just want to make sure when I'm explaining it to them, I'm not saying this is
Right.
what it is. I want to make sure I'm presenting it
I don't,
correctly.
the only caution that I personally would give you to that is we know what we set the funding formula for this pilot as. That funding formula may be totally different in the future in 2 years when they get to the point where they can no longer waive it, assuming that they go that route. As Sasha said earlier, we don't know. They could say, well, if this is what's coming, we might as well start it this year and build it over the next 2 years and not cancel it. We don't know. But so we don't know how they're going to create their funding formula at the state. I know how we created our funding formula for the pilot.
Mhm.
So my guess is that they will have some similar funding formula that will be based on your location and your quality level, your location, the need in the area, whether, non-traditional hours, all of the things that MyLeap is really, really focused on expanding access for, and they will have whatever funding formula they use. So that would be.
Unfortunately, we've seen so many of these things like pilots,
Yeah.
and it takes forever. I call it like we have the system that works and nobody wants to take the system that works. They want to break it and then come back and say, oh, that one worked. But I want to thank you, ladies. This has actually been so wonderful for our program. So
No, thank all of you. I know some of you may have to jump off, so I've put the toolkit that ECIC created as it relates to the new changes to subsidy. I'm going to jump real quickly just into the PowerPoint to pull up and tell you just some of the quick things that I've learned from some of you, some of the things that we've been testing, and then also just let you know like kind of what's coming. Please share with everybody. Do not delete my newsletter that I'm sending you coming in May. We have a huge opportunity. If you don't like your marketing materials, if you feel like you need help with your logo and you're willing to work with us, we are going to select some programs so that we have a geographic representation from across all of you ITQI providers. To work intensively kind of with a communications person to say, hey, Kay, let's update your website. Let's update your Facebook. What are the things you feel like you can't do? And you're going to have a report that comes out, and we'll also have it digitally available to all the programs that shows, hey, this is the home provider that has X number of kiddos. This is what was important to them. This is what we were able to do, and show like what that might cost and how much it might cost to maintain it. Because what I'm hearing from you all is you're getting approached by a lot of folks, and a lot of people want to charge you a lot of money to do some things that actually sometimes you don't even have to pay for. So we want to make sure that we get you those resources. So please make sure you read your newsletter. I see that Atava has a question, so I want to be respectful and answer that. If we don't get to the PowerPoint, know that we are going to have another session on this and we will share the PowerPoint. But my biggest tips are the rules have changed as of February. So you have to let families know. All of you are on here know better than me that the families are not getting the MyLeap or the press releases. And I don't want my husband in the next room who works for the Free Press to hear, but they're not reading the Free Press. They don't know about these changes. So we have to tell them this toolkit has the emails, the text, the social media stuff for y'all to use. So you don't have to do the work. You just have to copy it. I'm going to say this wrong because my mouth is still numb. I'm going to let you come off mute. There you go. Can you unmute, Atavia? I can see your hand raised and I don't have you on mute, so. Okay, you're off mute, so now we can hear you. I don't hear you. Is anybody else here? Yep, okay. If you want to, please throw your question in the chat because they're having trouble hearing you. I'm going to pull this up real quick just because I know many of you are nerds like me and trying to figure out how to recruit these families. So I want to be able to get you some of these tips. So again, you're going to have the link. I'm jumping ahead in the slides because I know we're going to run out of time. See? So the toolkit, when you get this, we're going to have it linked on the website, but this toolkit has the social media posts already written. All you got to do is copy and paste them. If you are feeling like, Maria, I don't have the capacity to do that, I need you to send me an email because we're going to be testing a new platform that will allow me to send an email to you, this super cool platform, and it'll say, hey, Maria's trying to schedule something to your Facebook, or Maria's trying to schedule something to your Instagram page. Do you want to allow her to do this? It'd probably say ECIC. I know that none of you have full-time communications people, most of you from those of you that I talked to. So this is going to be a real cool opportunity for us to be able to do this. My folks who are on from the resource centers, if you have partners or if you think your resource center would allow us to do this or want to test this with us in the next 3 months, please email me. You can either email ITQI grants at ECIC4kids.org, or at the end of this, you're going to see my email, the Maria or M Montoya. And we would love to know which of your partners you would like maybe for us to post with. And this is going to exponentially expand who sees the posts. For those of you who are like, Maria, what are you talking about? What's happened with Subsidy? Why are people calling it scholarship? The big news was as of February 25th, they changed the rules. So previously, so many of us know that families, when they would hear that if they submitted an application and they did not have child support in place, it would activate or open a child support case. That, as we know, has obviously a lot of equity issues and also a lot of potential domestic issues for many of our families. And so many families would then choose not to complete the application. This is huge because even if they were denied assistance before, they have to go back and they have to apply. They might tell you, but I did apply and I got denied. They need to go back and they have to reapply. Some of you are seeing approvals move pretty fast. For those of you who are seeing an extreme lag, please also email ITQI grants so that we can try to get a pulse on that. We've been, as we check in with MyLeap, been trying to tell them the areas where it's just moving really slow. Again, we have to make sure before you ping us, make sure that the parent has submitted the stuff on their end and that it isn't an issue with documentation missing. But where it is that you guys, some of you are having some really slow turnaround, we want to make sure that we get that uplifted. This is one of the things that's in the toolkit. I want to move this so you can see it. It has all the pictures and all the text already there. So all you really have to do is copy and paste it. But again, if you're willing to let me and the communications folks that I'm working with schedule those posts for you, all you got to do is answer my email where it says you want to let ECIC schedule something and you say yes or no. And it's that simple. You don't have to copy and paste. You don't have to go download things and get on your computer. You literally would test with us the ability for us to be able to schedule things to your social media. And we wouldn't be able to take over your social media. We would just be able to schedule certain things. Okay, this is the juicy stuff. You guys are learning some pretty awesome stuff. And this is why we wanted to schedule this session. Again, some of the future sessions will have our comms and media people. We're trying to get a tax facilitator on here. Y'all want to know about these taxes. You're getting these grants and you're like, Maria, these taxes are killing me. Laura's worried about y'all getting in trouble. You got to claim your stuff. So we're going to have tax folks, but my jam in my area specialty, so that you all know I'm not as brave as you. I can't take care of children. I feel like children and me, we have a time limit. But I am good with the marketing and the communications. And so if you want to test some things or send me some of your stuff, we'll be able to look at those. But you all are doing some amazing things with the toolkit already. Since February, I've been in touch with some of you, and some of you are just sending a text to families saying, hey, I know you didn't reapply. I know you were worried about this. Hey, did you hear about the new rule? And they're just actually texting some of these photos. Instead of just posting it to social media, they're texting and emailing some of the families that maybe have come off of subsidy or were deemed ineligible because they started to be asked about child support, etc. And that has worked for a good number of you. Some of you are hilarious. You took some of the memes off the internet, those funny things. And one that I have that I maybe will share in the newsletter was like, did you hear? Did you hear? And it was just sharing the news that the rules had changed. And so that was just sent also via text to some families. If you're super old school, which if Felicia's still on here, Lagarde, that was my childcare provider. I know that she knows that backpacking a note home always works because kids is like, there's a note in here, you got to read it. Miss Felicia said so. If you don't, I'm gonna get in trouble. Or she's gonna say you made a bad choice. My daughter tells me I make bad choices when I don't read the notes. So some folks are just simply taking these toolkit pictures, putting a note into the backpack and saying to a parent, share this with a friend. So if they have a child who's enrolled, they're in good shape, they're already on subsidy, that's fine, but let them tell 5 or 6 of their friends through some kind of flyer that you send home. Biggest one that's been the biggest win in the last 2 weeks is just taking this information in the toolkit, printing it out on white paper, and taking it over to the Community College Student Services office, or if you have one of the Job Corps or work offices near you, literally printing this out. People don't know. People have no idea. that the rules have changed. And so some of our ITQI providers have taken the toolkit images and just printed them out and put their phone numbers on them. That's a big part of this. They've put their phone numbers and their childcare name on there so that the counselors and the folks that are working with the people being placed in jobs or being placed in the Michigan Reconnect are sending those referrals to them because they know that the rules have changed and they're helping the families apply. Now, if you have a little bit more time, you want to make a little bit more effort and you're like, I'm going to knock this out of the park. I want to get some more of those subsidy dollars from Laura and the team so that I can add some more seats, etc. Here's some things that may cost you a little bit more money, but I'm not talking big bucks. But you can literally take the posts that are in this toolkit, go to Facebook, and you can add $20, add $15. You can boost them to certain zip codes. If there's zip codes that you know most of your children are coming from, you can literally add that little bit of amount of money and it will amplify your reach by at least 200, 300 people normally. If you don't know how to do this, if you're like, Maria, what are you talking about? This is some crazy gibberish you're speaking here. Again, email ITQI grants or send me an email and I will help you figure out how to do this. I promise you it is not hard. If my mother-in-law can do it at 80, y'all can do it too. I promise you. Okay, next one. I know y'all know some Uber drivers and I know you know some Lyft and DoorDash people. You might have some of them as parents. This one I just loved. It was outside of Ypsilanti provider. She literally took, again, one of the pictures, the message, and she printed it out. She said it cost her about $6 to make 200 copies or something in color. And she gave them to Uber and Lyft drivers who were her families. And they gave the information to people when they were talking to them and driving in the car on the weekend, the evenings. And she said that she's had lots of calls. Again, take that toolkit information, put your name, your phone number, etc. on it, so that if the families want to know how to apply or they want more information, that they're calling you for that referral. Let me see, what's this last one? Get to know all your academy directors. If you don't know what this means, this is my favorite thing that I've learned in the last couple of years. Every one of the police academies, the ambulance academies, all the different folks who do kind of emergency services. There's even an academy for the bus driver. Try to figure out in your city who is running those programs, because they are all under the gun to really get and recruit people for those programs. And I can tell you in my experience in the last 2 years, 95, 97% of those people qualify for subsidy. And they're so excited to have somebody try and help them, because the academy directors have to get a certain number of butts into the academy. And most of the time they start early. And so they can't send a kid to GSRP. They can't send a kid to a school-based program or something like that that has the traditional hours. They really need some of you who are offering the hours that work for those who are trying to train for these programs. And so this has been really huge for them. They will become a referral base for you that you will just like make it so easy. I had a provider who was only kind of marketing via Walmart and passing out flyers in the parking lot. And once she got connected to 2 academy directors in, I think it was down here, Southeast Michigan, but Taylor and Flat Rock area, she was able to, she said, I got my weekends back and I could go to Walmart and go shopping and not have to be putting stuff on people's cars. So that's what we want. Y'all deserve to have your weekends back. So these are just some of the small things. Again, we're going to have more sessions. I know we're almost 2 minutes till we're out of time. But again, read your newsletter. If you want this support, we are going to pick a select number of providers who say that they'll work with us. We're not going to hold these sessions during the middle of the day. If you need to meet with a communications vendor virtually at night or on a Saturday, we're going to make this work for you, because the TA is supposed to be for you all, but we need you to tell us that you want to do it, and it's going to come in that newsletter. If you have any other questions, most of you at this point know this general email address. And then again, if you're open to testing this platform where we will post for you, I'm going to need you to send me an email. if you sent me an email in the last 2 weeks, I apologize because Laura and Reba, who are on here, and who is Amanda, we went to some conference and they just did not stop sending us emails. So we are all trying to get our emails cleared, but you all know we're pretty responsive. But that was it, MIAYC, they busted up our email. So we are catching up. But do email us so that we can figure out if you are from a resource center and you know some partners that you think would be really great for us to maybe get onto that platform. I'm talking about like a workforce partner or even a non-traditional partner, somebody that all the families follow, and you know they have a big following. Let us know and we'll try to connect with them so we can try to get them to let us share on their platform. I've had a couple of you who've heard me talk about this and be like, well, that's not going to work. It works. It works every time. I used to tell every school district I've ever been with, or even early childhood network that I worked with, they'll be like, oh, we have to post it on ours. We have to post it on ours. And my superintendent, who thought everybody was following him, people are following the DJ, they're following the pastor, they're following the guy who runs the Chuck E. Cheese or the bounce house. They're not following just the traditional people. They're following the people, that they really want to hear from and they make sure that they see every day. And so we need to start getting y'all's information to them. For those of you who've been asking, how are we promoting your seats? That's exactly what we're trying to do now. So we have in each of your regions, each time you fill out those reports for Laura, Riva, and Amanda, if you say you're having trouble, we're trying to identify in each area who are the people who have those followers so that we can get them to share your stuff, so that we can get them to go to your profile page on Great Start to Quality and that they can get connected to you. If you're saying that you're posting jobs or you need help with recruitment, again, because you heard me say at the beginning of this, it's also about the recruitment of the employees. We are also working on that. How do we get you more social media posts that say I'm hiring and getting those to the people who are posting to the individuals who are looking for jobs? And so when we're talking about marketing and recruitment, we are again trying to find those opportunities and solutions for you all that are not just for recruiting the families, but how do we also help you recruit the staff that you need. Coming next month, we will add to the job board page already written job descriptions that you can edit. This is one of the things that you guys said, so we want to hear from you via email. We want you to come and jump on with us virtually when you can, because all of these things that you're hearing about came directly from your feedback. You said you didn't want any more 2-hour, 3-hour sessions. You don't want any big books that you ain't ever going to read. You want these real-time things that will help you. So we're trying to get those things to you. This is what's going to be posted. We'll post the video. We'll get you Sasha's slide deck. We'll get you the cases that she talked about, or the case brief, I think, or policy brief that she talked about. And we will also get you this link to this toolkit. But again, that will be in your monthly newsletter, and it'll also go up on the ITQI provider part of our website. I talked really fast because I'm over, but if you have any questions, I will stick around for sure. Yes, I am embedding myself into the great starts. You guys updating your enrollment info is being a big hit with our Great Start collaboratives and some of our workforce partners. So please, if you're updating your enrollment info, don't stop doing that. It's required, but I know some of y'all be getting busy. I need you to update your enrollment information because our workforce and training centers and Great Start collaboratives are really loving that you are updating your enrollment. I think Kelly asked where you guys could get this information. The Great Start, the ITQI page, anybody can access. It's not password protected. Laura, can you put that on there? Right, it doesn't have a password. Thank you all for joining us. Feel free to hop off if you have questions or you want to ask something also that's logistical or technical or money related. Please feel free. Laura and Reva and Amanda are still on. Felicia, you're always going to have a waiting list. That's why you're never going to be able to close. If you all have never been to Crystal Swan, you need to go there for lunch. They have the most amazing lunch for a preschool that I've ever seen. Thank you, Sasha, too. I think she jumped off, but thank you so much. Thank you, team, for jumping on. I know you had a million other things to do. Is that Tammy? I see your hand raised. Go ahead.
Hey, I have a quick question. If our star rating changed, will that change our reimbursement rate as well under the current slots and things we have, because our license changed and now have a different star rating? And I know it changed my reimbursement rate through subsidy. So will it also add additional funds from you guys?
No.
Laura's shaking her head. Nope.
No, if your rating went up, you're going to be, if we had 6 programs who were re-rated and their rating went up, they will be getting a bonus. If your rating went down, you won't be getting a bonus. You also won't be having money taken away.
So our rating went up.
Then you will be getting a bonus.
No, we will, and you guys already know that?
Yeah, Reva, go ahead.
Yeah, so basically our maintaining health and safety and reflecting on quality, if you were in one of those tiers and you went up to enhancing quality, validated, or demonstrating quality. So if you went from like what would have been a 1, 2 to a 3, 4, 5, there will be a bonus for that.
Do I have to do anything on my end, or are you guys automatic?
We got it covered.
That'll just make so many people so happy that I did that. Thank you so much.
You're welcome.
Woo-hoo.
Anyone else with any questions that we can assist with? Sherry, go ahead.
Okay. Hello.
Hello.
Hey. So I don't know if it's one or two things, but basically, I was up to get my class rating and go through the assessment process again.
Mhm.
But I have literally been waiting 2 months just to get a phone call to verify and validate the things that I uploaded.
Mhm.
And I don't know if that affects me in any way. But
So
I
as
know
of
it's
right
affected
now,
me.
as we've been saying from the beginning, it's like a year-long process to go through the full validation, assessment, observation, like the whole process to change your star rating. That's why we were telling people at the beginning of the grant, like, go ahead and get started on the process. As of now, if you have started the process, there's a good chance that it will be done by the end of the grant, at which point, our last round of bonus payments will go out with the September grant. With the September grant payment. If you haven't gotten scheduled yet, then it probably won't be done by the end of the grant. And there's really not any wiggle room that we have on that. So, I apologize if it's but like I honestly don't know the process that well. So I know they're backed up with observations. I can certainly, if you want to email us, I can certainly have reach out to them and see where they are in your particular process. In fact, I just this morning sent something to that team to ask like where all of our providers were in the re-rate process. So we can do that, but unfortunately I can't like push you ahead in the queue or anything like that. It is a long process and they are doing their best. They are behind. The CDA observations are too, I know. So,
Okay. Okay, thank you. I will email you because honestly, I've already got my observation done because I had my own person. It was just the phone call after that normally used to take 2 days. It is that part that I'm waiting on for the validation. So even if after they get the validation, it would take it to a 4, they will be waiting for the other results. It's affecting my pay from DHS because it's putting me at a 3. So I'm thankful for this grant program in the midst of this process. But I would definitely email you as well.
Okay. Yeah, so what Tammy said, they're backed up several months at this point right now. So I will tell you, we have two new assessors starting, so that will hopefully, they're finishing up job interviews this week, so hopefully that will help lessen some of that backup and will help it in enough time to get it done by the end of our grant cycle, the end of the fiscal year. But we are aware that it is, I mean, it's a long process to start with, and then if they're less than fully staffed, actually they are fully staffed, they're adding more staff at this point. It's not even they're not fully staffed. It's we've had so many people applying for validation that they're adding more positions to it. So all right. All right.
I think we're good. We're 10 minutes over. I'm going to stop the recording.
All right.